And let's since you brought it up, let's spend a few seconds on stroke shoulder. And yeah. So the evidence. So again, if you go back to EBRSR or Stroke Engine's another good one. If you look at the research, some of the myths out there are that slings will reverse subluxation, taping will reverse subluxation. So we do know for sure from the evidence that you're not going to magically reverse subluxation with taping and slings. The research does suggest that it is beneficial for pain management, that you can reduce pain through taping and slings. And it also suggests that you may prevent further dislocation if you, during transfers and mobility, that the arm is just not continue to be stretched. And that seems to be obvious, right? I mean, the more the weight, subluxation kicks in within 3 weeks. So if you have a flaccid arm, it's going to happen within 3 weeks. So what can we do preemptively in that subacute setting to minimize that stretching of the inert and non-inert structures at the joint capsule and the proximal, the dynamic stabilizers, the muscles. And so we know taping and slings, don't count on them to reverse the subluxation or prevent it. You can maybe minimize the dislocation, slings, but for taping, we did radiograph studies years ago where, remember, this is a thin piece of tape on the most superficial part of your body, and your skin's very pliable. There's no way it's going to reapproximate a humerus into a joint. So you're fooling yourself if you think it. Now, remember, there's kinesio tape, which is a flimsy, stretchy stuff from Walgreens. That's been around forever, and I love that for certain conditions, just not for lifting up a 5-pound humerus. And then there's McConnell taping, which is that static, non-elastic athletic tape, and that was used a lot too. But when you X-ray that, you're not seeing a reapproximation. It's not even sustaining that thoughtful reapproximation.